Establishing a good latch is crucial for successful breastfeeding. A good latch ensures that your baby is able to effectively remove milk from your breast, which in turn helps to maintain your milk supply and prevent issues such as sore nipples and low milk production. So, how can you ensure that you have a good latch when breastfeeding your baby? First and foremost, it's important to make sure that you are in a comfortable position when breastfeeding. This means finding a chair or couch with good back support, using pillows to support your arms and baby, and making sure that your baby is at the right height to latch on comfortably. Many mothers find that using a nursing pillow can be helpful in achieving a good latch. Once you are in a comfortable position, it's time to bring your baby to your breast. Make sure that your baby's head is in line with their body and that their nose is opposite your nipple. Gently touch your baby's upper lip with your nipple to encourage them to open their mouth wide. When your baby opens their mouth wide, bring them to your breast so that their chin touches your breast first. This will help to ensure that your baby has a deep latch. As your baby latches on, make sure that their mouth covers a large portion of your areola, not just the nipple. A good latch should feel comfortable, not painful. If you are experiencing pain while breastfeeding, it may be a sign that your baby is not latched on correctly. In this case, gently break the latch by inserting your finger into the corner of your baby's mouth and try again. It's also important to pay attention to your baby's sucking pattern. A good latch will result in a rhythmic sucking pattern with pauses in between sucks. If your baby is sucking continuously without breaks, it may be a sign that they are not latched on correctly. In this case, gently break the latch and try again. Another important aspect of establishing a good latch is to make sure that your baby is able to breathe while breastfeeding. Your baby's nose should be clear of your breast, and you should be able to see their lower lip flanged outwards. If your baby is having trouble breathing while breastfeeding, gently break the latch and try again. It's also important to make sure that your baby is getting enough milk while breastfeeding. A good latch will result in your baby's cheeks being rounded and full while they are feeding. If your baby's cheeks are sucked in or dimpled, it may be a sign that they are not latched on correctly. In this case, gently break the latch and try again. If you are having trouble establishing a good latch, don't hesitate to ask for help. A lactation consultant or breastfeeding support group can provide you with tips and techniques to help you and your baby achieve a good latch. Remember, breastfeeding is a learned skill for both you and your baby, and it may take some time and practice to get it right. In conclusion, establishing a good latch is crucial for successful breastfeeding. By ensuring that you are in a comfortable position, bringing your baby to your breast correctly, paying attention to your baby's sucking pattern, making sure your baby can breathe while breastfeeding, and ensuring that your baby is getting enough milk, you can help to ensure that you and your baby have a positive breastfeeding experience. Don't be afraid to ask for help if you are having trouble establishing a good latch, as there are many resources available to support you on your breastfeeding journey.